And welcome back. As many as 1 in 5 women may have fibroids during their childbearing years. Uterine fibroids are non-cancerous growths developing in the muscle cells in the uterus. American Fibroid Centers are prominent leaders in modern fibroid care and offer innovative options for women. Joining me to tell a little bit more details, we had the Chief Medical Officer at American Fibroid Center, Dr. Elsie Koh, in an interview, and she shared with us the importance of knowing. But talk to me a little bit about when we talk about uterine fibroids. It's very prevalent, and we talk about 1 in 5. That's a huge number.
Yeah, it's more than people think, and a lot of women. If you're going to see your OBGYN, that's great. If you're seeing your internist, that's great, because there's a lot of symptoms that these women get that are preventable that people don't realize, and it's more than just taking hormone pills.
Yeah. So let's talk about symptoms. When we talk about the symptoms for uterine fibroids, what are some of the more common symptoms that maybe we're not paying attention to?
Well, the most concerning symptom really is the bleeding, the heavy bleeding that a lot of women have. They tell you that they have to change their pads 8 to 10 times a day. They become anemic because they've bled so much that they're weak, and they can't even go to work. Sometimes they don't even want to get out of bed. And the only blood work will show that they're very anemic, and sometimes they have to get iron transfusions or even blood transfusions. So the other symptoms have to do with the bulk-like symptoms, because these fibroids can grow really large, almost as if a woman appears pregnant. So because they might appear pregnant and it's that large, the bulk-like symptoms really push on the organs inside, so they can have problems like with back pain, pelvic pain. It's pushing on the bladder, so they have to go to the bathroom a lot. They feel constipated. They have difficulty with sexual activity. It can be really, really tough on women, and they might not even know they have it.
Yeah. So when we talk about having it, there's also treatment that's available. I know that surgery is an option, but there's also non-surgical options. I'm correct?
Yeah. So I think one of the important reasons why I'm here talking today, I'm very grateful to be on here, is to let women know that there are other options that might not have been shared with you from your physician. And it's a non-surgical option. A lot of women don't want to have surgery. They don't want to have their uterus taken out. And this is a non-surgical way of treating fibroids. It's called uterine fibroid embolization, or UFE. And what that means is it's a minimally invasive procedure. It's a same day outpatient procedure. You don't go to the hospital. And we first see you in consult to talk about it, so you're very comfortable with us, and you know exactly what's going to happen. But in a nutshell, it's basically getting a tiny little straw or catheter into the uterine artery from a tiny little incision in the groin that you'll leave with a Band-Aid. And we basically inject some particles to really seal off and close off the blood vessels that are supplying those fibroids. And what's different about it from, let's say, myomectomy, which is where some OBGYNs, some surgeons might go in there and remove 1 fibroid or 2 fibroids, but they'll leave the other ones behind, because you can't do surgery on all the fibroids. And a woman a lot of times have multiple fibroids throughout the uterus. And what the uterine fibroid embolization is different is that it takes care of all the fibroids through a minimally invasive way. I mean, the other alternative to get rid of all of them completely is to take the uterus out.
And when we talk about taking the uterus out, we hear a lot about the word hysterectomy, and you just gave us another term. Can you give us a little bit of the difference between one and the other, because many people are familiar with the hysterectomy?
Right. So hysterectomy, first of all, it can be done in front through the abdomen, or it can be done through the cervix. I don't know, a lot of people don't know about that. It's a major surgery, and you're going to be out of commission for a couple of weeks. You're going to be hospitalized for that. The myomectomy is less invasive, because a lot of times it's done laparoscopically, which means they go with a camera, and you might have 3 holes. They have to inflate air into the belly so they can see what they're doing. It is more invasive still than the uterine fibroid embolization. The recovery is much easier. You can also have fibroids that go inside the uterine canal, and sometimes they might do what's called hysterectomy hysteroscopy, which is where they put in a camera through the cervix, through the vagina, and remove the fibroid that way. So again, those are just piecemeal, removing pieces of the fibroid, just one or two at a time, or maybe three. The uterine fibroid embolization is a tiny incision in the groin and basically closing off the blood supply to those fibroids with a catheter. And you basically, the recovery is much faster. Within 1 week, you can go back to work. Most women, I've seen my sister go through it. I actually went through it with her in the 24-hour period. And we've been, it's been around for so long that we know much better ways of pain control. I've been in practice for almost 20 years, and I've seen such a massive shift in how uterine fibroid embolization was done. Used to be that some women would be, every woman used to be hospitalized overnight. And now more and more people are doing this as an outpatient.
Do you find that there's a tremendous amount of fear when it comes to this? That's why sometimes people are not really coming your way when it comes to really dealing with this, because there are some people who say, listen, I had this, but yet and still I'm comfortable in riding it out.
Definitely. There's a lot of fear of the unknown. That's why I encourage you to reach out, even if you decide not to do it, just come in for a conversation about what's going on with you. If I would definitely say, see your OBGYN. And if you got an MRI, bring your MRI disc or report with you, because that will tell us exactly what needs to be done. We'll also talk about the hysterectomy, the myomectomy, all the alternatives, because we're not here to force you into anything. We want you to be an informed patient who can make the right decisions for yourself. A lot of people have fear, but one of the top reasons why people don't come to us is because they don't even know it exists. A lot of OBGYNs are not familiar with it. The American College of Obstetrics and Gynecology has accepted this as an alternative means for treatment of fibroids in 2008. So it's not that the society doesn't accept it, it's that a lot of physicians are not cognizant about the procedure, and therefore the patients don't even know.
Yeah. So if someone's watching right now and they're saying, listen, this sounds like, I need to take a step forward and really get connected in going forward with this, what do they go about doing in terms of consultations and getting connected with you?
If you want to speak with somebody through telemedicine and you don't want to wait, that is completely fine. Or you could just wait for the consultation to come in and see us. Either way, just know that the entire team is there. We're ready for you. We know exactly what you need. We do this day in and day out. So because we're so super specialized in what we do, we know how to treat the patients, and even afterwards, how to make sure you're comfortable at home. You could have what feels like significant cramps, like, your menstrual cramps. There's variations in what people experience. I've seen my sister go through it, and I felt like, oh my God, she didn't even look like she was going through it, because we have you take a cocktail of medications when you get home to make sure you're on top of everything before you feel the pain. Now, I'm not saying you're not going to feel pain like my sister did, but I'm saying that if you follow the instructions that we give to you, and we're going to be so clear on what that is, you're gonna do much better than having a surgical procedure.
Dr. Elsie Koh. Now, for more information, you can visit their website at fibroidexpert.com. Don't go anywhere. We've got more open coming up right after this.